This video is explaining the actual process of performing a dental implant. There's of course a medical history and we need to explain the options of treatment to patients, but this is just a technical process once we've done all that to just summarise things. So what we normally do is we take impressions and we will set some teeth up, either with some denture teeth on a model if the teeth are missing, or we'll wax up or change the shape of the form of the teeth. And we'll then take an image of this and fuse a three-dimensional X-ray data set with this wax up or diagnostic setup to plan the actual implant position in relationship to where we want the tooth to be. So the idea being is this implant should be placed about 3 millimeters from the gum margin and insufficient bone to support a tooth. So this is again a three-dimensional image of the proposed implant. And this is all pre-planned before surgery. So from the pre-planning we need to choose the right size of implant. So we want the correct size, not too big, not too small. Now if it's too big, the implant is too close to the adjacent teeth. We want about 1.5 to 2 millimeters from the teeth. If we get too close to the adjacent teeth, we can damage the adjacent teeth. We also need to have sufficient bone and gum on the outside so the tissue lives. If you go too close to the edge, the bone thins out, it can actually shrink and die back. So we want the optimal size of an implant. If the implant is too small and you have a big molar on top of a small implant, the implant can fracture, the screw can come loose, and you can have prosthetic complications because the implant is too small, whereas you can have biologic complications if the implant is too big because you're too close to the teeth and you've used up all the bone placing the implant. So again, from the planning we determine the implant position, we print up a surgical guide. Now that guide has two little tubes with a series of rings, and so the drill is designed to go directly down that hole that's been provided, and it stays within that, and so that's accurate to about 0.2 of a millimeter and a few degrees. The implants are placed. We then place little what we call scan bodies on the top of the implants, and then we can scan this intraorally with a digital scanner, and then we can make some ceramic temporary crowns. These took from start to finish, the surgery to the temporary crowns, about 2 hours. So this is a photo that was taken 2 hours after commencing treatment. Now what we normally do is let that heal up for a few months, and then we'll go back and take an impression and make 2 ceramic zirconia final crowns, and in this case we did some veneers as well at the same time. So that's the implant, abutment and crown, implant, abutment and crown, veneer, 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 implant, abutment and crown. The case is completed. In cases where we don't have sufficient bone or the bone is damaged, sometimes we can't do an immediate implant. We may, if the root is fractured and the bone has been lost, may have to clean this up and do a repair, a graft procedure, wait a few months, wait for the bone to consolidate, and then go back and do the same procedure at a later date.